today on CityCast Madison. There's been a spike in opioid overdoses in Madison recently. Public Health reported 9 overdoses at the end of May and another 6 in mid-June. 4 people have died. What's going on? Public Health says that the synthetic drug fentanyl is driving a public health crisis, and fentanyl is showing up in a lot of drugs, not just opioids. We talked to Julia Olsen of Public Health Madison and Dane County about what's happening and what you can do to stay safe. It's Wednesday, July 5th. I'm Bianca Martin, and here's what Madison's talking about. Julia, hello.
Hi, Bianca.
So, Public Health recently issued 2 overdose spike alerts in less than a month. Do we know why there's been an uptick in opioid overdoses?
That's a great question. I think that it's a little hard to pinpoint why. Sometimes when we look at information daily from emergency medical services, so EMS, our paramedics who go out and respond to calls for possible overdoses, and we look at our hospital data each day, sometimes we see there's very clear things. A person may have thought that they were taking OxyContin, so like a prescription pain medicine that maybe they got from someone else on the street. And it turns out that a lot of people who thought they were getting that ended up overdosing and having to have EMS called or go to the hospital. One thing that has been a little different lately with these spike alerts we've issued, usually when we issue a spike alert, within a couple of days, we'll see things going down, kind of going more back to normal of what we would see on a day-to-day. We issued our most recent one. So between that and the one we issued almost just a month before, we've kind of seen things remaining high and always pushing our baseline each day. And we issued this new alert because we finally saw things tipping over.
We also did see a spike during the pandemic. Do we know are overdoses still on the rise in our community from that spike?
The actual overall number of overdoses that are occurring, it isn't really that much different than what we've seen in past years. But the thing that has changed is that we're now seeing more overdoses that are severe, i.e., you need to go to the hospital, there needs to be some sort of an ambulance called, or fatal. And really those fatal overdoses are being driven by opioids, particularly fentanyl is a strong driver of those fatalities. But I think overall, what we've seen nationally, we've seen that deaths have increased. They're at the highest number they've ever been nationally. So I think, overall, locally and in the United States, we really do have a mental health crisis. We have an overdose crisis. And unfortunately, I would say trajectory, it's probably going to get worse before it gets better.
The opioid crisis was such a big thing pre-pandemic. Like 5 years ago, I remember that was like nationally the conversation, just like what is happening? And so to hear, we're having spikes right now, it does feel like we're in a tricky place. It's still going strong, unfortunately.
Yeah, no, it is a really tricky place. And, for those of us who have worked in like substance use prevention and overdose prevention for decades now at this point, we're kind of used to seeing new drugs pop up all the time, whether it's been prescription pills, prescription drugs really leading it. We see things happening in waves. Certainly opioids is a bigger challenge than we've dealt with in the past because back in the day, when it was prescription medication and things were being given out like candy, there's lots of availability. Opioids particularly can have really strong impacts on people. And to use my public health term, if you are opioid naive, I am not a person that uses opioids. So how it reacts in my body is going to be very different than somebody who maybe does use them a bit more regularly. And I think that's also a little bit of what has been really challenging about finding fentanyl mixed into the drug supply and so many other drugs like non-opioid drugs.
Right.
You're a stimulant user. If I'm someone who maybe occasionally uses cocaine when I'm out at a bar. I am opioid naive. I don't have much of a tolerance. I don't expect that fentanyl is going to be in my cocaine. And I'm not in a peer group that has folks who regularly use drugs. So they don't know what an overdose looks like and they don't have Narcan with them. I'm at much higher risk for a fatal overdose if I happen to get something that had fentanyl in it. So it's we're seeing this kind of from so many different angles. Opioids is a huge challenge.
Yeah, and want to get into that in terms of, it's popping up in other places that we didn't expect. But first, can we talk about like how is fentanyl different than other typical opioids?
Yeah, so most of the fentanyl that we're seeing contributing to these overdose deaths, to people dying from overdoses, it's usually what we would say is synthetic. So synthetic means it's made in a lab. It's not like the medical grade fentanyl that gets used in hospital settings for, chronic pain patients, cancer patients, folks like that. It's not that being kind of diverted from those systems and making its way into the drug supply. It's usually lab-made, synthetic-made fentanyl. And most of the time, this stuff is added to the drug supply to extend your batch. If you're a dealer, you'd call it an adulterant, right? It's something I'm adding to extend either the amount, the life of my batch. But it is, again, the thing with synthetic fentanyl, there's no regulation, right?
There's no testing of it.
There's no quality control. So if I make a batch that somehow becomes much stronger than what it's supposed to be, there's no regulating body telling me, nope, you got to toss that. There's lots of potential for cross-contamination. So when I say this, I usually think about if you were working in a restaurant kitchen, you have standards for cleaning. You have standards for don't mix your chicken and your beef or your seafood. You try to avoid allergens. You try to do all those things. When you are working in a lab that's making different types of street drugs, you don't have those standards. So it's really easy to cross-contaminate a surface with fentanyl because you don't have those standards. So the reason I bring this all up is that fentanyl is very unpredictable. There's no measures, controls. There's nothing regulating how much is getting into a supply. The potency is very different. So what I might take today that I, again, can tolerate just fine could kill me tomorrow. And I don't mean to sound alarmist, but that's kind of the issues we're dealing with.
Or maybe we should, you're here to, a little bit ring the alarm because, you're talking about the potency. I saw some figures, it could be 25 to 100 times more potent.
Yeah, absolutely. You'll see those numbers quite a bit. I think, the key takeaway, not so much, is it 25 or 100 times more stronger? It's hard to know because again, there's no quality control.
Like 25 times more potent than heroin.
Yeah.
I mean,
I think the key takeaway is that it's extremely strong, right? And it's not just something that's easily tolerated. So there's a lot of risk in having fentanyl mixed into something, again, like cocaine or a pill that you're not expecting. That's why we really try to push the messaging of if you or someone you know or are close to uses drugs regularly or occasionally, know how to recognize an overdose, know how to use Narcan, make sure you have it available. CPR, rescue breaths, those are always a good thing to know how to do. Call 911 for support. And there's reasons why people don't call 911, but I really, with all the new things out there in the drug supply, try to emphasize Narcan might not always be enough to revive someone, or it might not be enough to deal with everything that could have been in that drug they consumed. So try to get them in a rescue position, give them rescue breaths, call for medical assistance.
And for those who don't, maybe have heard of Narcan, can you just briefly explain what Narcan is?
Yeah. Narcan is basically a life-saving medication that reverses an opioid overdose. So to be really clear, it's like putting up a barrier. Opioids, there are opioid receptors in your brain. The opioid, when you take a drug, it kind of binds to those receptors, and that's what gives you those highs, that euphoria, but then can also cause your body to go into that overdose state. I like to say that Narcan or naloxone is another name you may have heard for it.
Mm-hmm.
It kind of acts as a barrier and pushes those drugs off of those receptors in your brain. So it can bring you out of that overdose state.
Well, you brought up something that we also want to discuss, which is folks might feel hesitant to call 911 in terms of when you issue these like public health overdose alerts. Is there information that's being shared with law enforcement, or is that used in service to make arrests?
Yeah, there are so many reasons why an individual might choose not to call 911. We do have a Good Samaritan law in Wisconsin that would protect you as an individual from certain things if you were to call for help for someone who's overdosing. So say you're with them, you may have drugs on your person, and you may have paraphernalia. There are certain protections you would have as a caller in that situation. Unfortunately, some of the really strong parts of our Good Samaritan law did sunset or expire during COVID and haven't necessarily been reintroduced, which means if this is my best friend who is overdosing, and I know that they may have an outstanding warrant, or I know that they're in a custody battle right now with a ex-spouse, right? They could potentially be getting arrested. They could lose their kids. They could lose their job, their housing. I think there are a number of those very real concerns that someone might have. So I try to always encourage people to call for medical help, to call 911, but I don't want to discount that there are very real reasons why an individual might choose not to do that. We do still very much have a drug war in this country. We do still have lots of incarceration driven by drugs. So again, I don't want to discount that there are very real barriers why someone might not want to call for help.
Yeah.
It's really a complex issue. But yes, at the end of the day, we want folks to give Narcan. We want them to try to intervene to save someone's life as best they can.
Yeah. One of the solutions that is on offer now from y'all is like a kit to help folks test the potency. It's a recognition that people are likely going to use drugs. Knowing that, here's a kit. Can you talk about that and how that works?
One tool are fentanyl test strips. Back, I would say January of 2022, when we started offering these at Public Health, we weren't maybe seeing fentanyl as much in the drug supply as it is now. So we had folks who were really trying to avoid it. They would use the fentanyl test strips to see what's in their supply. Let's also level set. Your street level dealer may not know what's in their supply either. They may not know that there's fentanyl or other nasty things in it. They don't always know. They have to kind of go with what they're told. So when we introduced these fentanyl test strips, it was really a way of giving someone more information so they can make informed decisions about their use. Whether it's, I'm deciding that I don't want to use this product, or it's, there may be some increased risk to me. At least we're giving you information so you could take different steps, like not using alone, making sure you have a safety plan, making sure Narcan's on board. I think where we have seen some of this change a little bit, many of the folks we see who are opioid users or think they're using heroin, that's what they're trying to get, will tell us now that I can't really find anything that doesn't have fentanyl in it. So they may be a little less likely to use the fentanyl test strips because they'll just say, like, I can't really do anything differently. However, we've definitely seen some of our folks who are non-opioid users, they're stimulant users, they think they're using stimulants, they're not trying to use opioids, who have been using the fentanyl test strips quite regularly. So again, it will tell you if fentanyl is in that batch of your drugs that you tested.
Okay.
Is it there or is it not there? It's kind of like a pregnancy test. It's either yes or no.
Okay, so it doesn't tell like how strong it is. It's just if it's there. How are people getting these kits, and how do you know if they're successful?
Yeah, so at Public Health Madison Dane, we have offices on East Washington and South Park Street. We give out fentanyl test strip kits. We also have a little kind of pocket information thing where we tell you how to use them. So if you're getting them for the first time, we may just take a minute or two to run through with you. We can help people make a safety plan, and we definitely promote a resource called Never Use Alone. It's a national phone line. It's run by peers, people in recovery, and people with lived experience. It's literally someone who can stay on the phone with you if you're going to use and you have to be alone, and who can enact whatever safety plan you've come up with them.
Yeah, and we know people often get hooked on opioids for medical reasons, pain. that's a thing. It's not the only way, but it is a thing. And that's why we're seeing these big payouts from pharma across the country, including here. Attorney General Josh Kaul, announced not too long ago that we'll be getting $17.3 billion in opioid agreements from different drug makers. What do you hope the settlement money might do for folks who are struggling with addiction?
I would really like to see harm reduction services expanded and be a little bit more embraced. I'm kind of a preventionist at heart in many ways, but I also really embrace harm reduction, trying to reduce stigma, meet people where they're at, understand that people use drugs for many complex reasons, and that our place isn't to condemn or judge them for it. It's to provide care and to be compassionate. They are people, they're our friends, they're our family, they're our neighbors, and they need support. I would really hope so things like, again, a syringe services program like we operate, and then maybe there was a little bit more openness to things like safer smoking supplies. I would also really like to see some more investment in peer supports and having people with lived experience be able to, again, just be a support to someone to help them through as they're struggling. I have probably a laundry list of things I could say, but one of my top ones is to really invest. There's a lot of investment in treatment and recovery, and I think that is very, very much needed. But at the end of the day, I think over time, we've either kind of invested in opposite ends of the spectrum, right? It's been all in on prevention or all in on treatment. And where I think things have kind of fallen through in the United States over time is acknowledging that people's use, it changes, that people are going to use drugs. Just say no is not a reality. We can't just expect you to just stop. There needs to be support for harm reduction, for medication-assisted treatment, and anti-stigma. So those are some of my, I think, hopes and dreams.
Julia, thank you so much. This has been incredibly informative. You are wonderful.
Oh, thank you.
Julia Olsen is a supervisor at Public Health Madison in Dane County. To learn where to find free fentanyl test strips, Narcan, and syringes, check out our show note for a link. And here's what else Madison's talking about. That Union Terrace chair. Did you hear about this? An alum who stole a chair from the UW Memorial Union returned it 30 years later. She was outed by her kids. The police didn't find her. And it sounds like if you know anything about a missing Union chair, you can return it, no questions asked. And the Madison Public Market is one step closer to becoming a reality after years of debate and delays. Later this month, the city is set to approve a lease and a contract with the nonprofit. It will operate the market on 1st and East Johnson. The new market will feature local vendors selling fresh produce, prepared food, as well as arts and crafts. It'll also house a food innovation center intended to help jumpstart entrepreneurs. The city council is expected to vote on the final contracts later this month. That'll put the market on track to open spring 2025. Construction is slated to start at the end of the year. That's all for today, here on CityCast Madison. I'm Bianca Martin. If you enjoyed the show, why not share this podcast with a friend? You might just save a life. We'll be back tomorrow morning with more stories from around the city. Ciao. Yes, the gray, it's very Les Miserables, except for not because no one's eating the chairs. Okay.